Yeah, we're live now. We are live now. Did you hear? Sorry.
Sorry, I was expecting an intro. Good morning, everybody. Good morning, good morning, good morning. How is everybody doing on this 20th of April? The sun is shining.
Yeah, thank
And
you.
it's amazing that we're moving into spring. You know, we can start taking those layers off. Forgive me, I'm the original black man. I'm normally wearing 3, 4, 5, 6 layers because I don't play with this cold. So welcome to the Kathip, the Khan Health Hour. My name is Dr. Ayo Olatoye. I'm your host this morning, and we have a fantastic hour for you, talking about dental hygiene. Now, what I really love about the Khan Health Hours is because there are so many aspects of our lives that we don't necessarily think about all the time. And we have so many experts in our community that can bring information to us and help us live a better life. So, without further ado, I want to introduce to you today our illustrious guest, Dr. Fortune Glavee. Now, she has a number of accolades, and we didn't have time to talk about everything she's accomplished. So let's just go with the ones that we have time for. So she has a Master of Science from King's College London in Community Dentistry. She didn't stop there. She's got a Certificate of Advanced Dental Leadership. And she is a member of the College of Dentistry. So those of us who are medically trained, being a member of these societies is a very big deal. She's also got an award in educational and training at level 3. I heard that there was only level 2 and they invented 3 for her. So, you know, this is fantastic. Dr. Fortune Glavee, we're really looking forward to this conversation about a confident smile. So without further ado, I'm going to hand over to Dr. Glavee. Please take it away.
Thank you, Dr. Ayu, for the introduction, and thank you for inviting me. I am super excited to be here. I'm going to start sharing my screen now. Can you see my slides? All right, okay.
Yes, we can. Thank you, Doctor.
All right, okay. So confident smile. Prevention is better than cure. Learning outcomes. The reason we have in the, what is the why? Is to understand the importance of dental health, knowledge of dental prevention techniques and tips, and promotion of dental health in the community. It is like a form of oral health promotion program. Now, I would like people to write in the chat, what do they think is a confident smile? What does a confident smile mean to you? So it'd be nice if people could write in the chat what a confident smile means to them. This picture summarizes what a confident smile is. This person in this picture looks happy and is smiling. You know, some people, when they take pictures, they don't like smiling in the picture. When they take a picture, they don't like smiling. They cover their teeth, and that is not confident. But this is the confident smile. This picture really summarizes what a confident smile is. It will be very interesting if everyone can put in the chat what a confident smile means to them. Now, one may ask, why? What led me to this webinar? So one day, I went to work and I noticed that a lot of children were being put to sleep to have their teeth removed. What people don't know is that dental decay is a preventable disease, and it is sad to see these children being put to sleep to have their teeth removed under general anesthesia. Now, if a child is being put to sleep just to have their teeth removed under general anesthesia, it is a big operation. You need anesthetist, you need nurses, you need theater staff, you need theater space. And I felt that should be used for those with special needs, those who cannot be able to go to the dentist, instead of putting maybe children just because their teeth are rotten and they have to put them to sleep. Due to lack of knowledge, a lot of people do not know that as soon as a child has got their first set of teeth, they need to register them. So I'm very passionate about dental prevention. There are a lot of different parts of dentistry, but my policy is prevention is better than cure. That's why I'm passionate about dental prevention. And we need those oral health promotion programs to educate people or empower people about their dental health, to help them have a healthy gum, healthy teeth, and confident smiles. Because when you've got a confident smile, it helps with your self-esteem. It helps with a lot of things. People do not realize how important the teeth is. I remember there was a story about a politician, and this story was that she had some dental work done, and later on she couldn't pronounce certain words, and it sort of affected her next election. So if you don't have teeth, you can't speak properly, you cannot eat, you cannot do a lot of things. So it is very, very important that we take good care of it. This is a fact. I didn't make this up. This is a fact. So on the 8th of February, 2024, The Guardian had this published. It says the number of children having rotten teeth extracted in hospital rises to 17%. And do you know how much this costs the NHS? It costs the NHS 40.7 million pounds a year. Yes, that's right. This is the fact. This is the fact that was published by The Guardian. 40.7 million pounds a year. Dental decay is preventable. Can you imagine what you can do with that amount of money, even doing health promotion? I want everyone to put in the chat what they think dental decay is. If someone has got dental decay or caries or rotten teeth, what do you think causes it? You can put it in the chat. I'm going to keep it simple. So one may ask, what is dental decay or what is caries? Dental decay is when the bacteria in your mouth feeds on the food you've eaten, that is the sugar in the food, and after some time, it produces acid. This acid is a byproduct of bacteria acting on sugar. This acid affects the teeth. It attacks the teeth. And when it attacks the teeth, it leads to decay. When it is active, it looks brown and soft. But when the caries is arrested, it looks black, like what you see in the picture. Yes, the teeth can repair itself. So if there's someone who is eating a lot of sweets, and then maybe after oral health promotion, and you are told, for one, I never tell people not to eat sweets because it's not realistic. If you tell a child don't eat sweets, they'll go behind your back and eat them. So the best time to eat sweet is after food. So after food, if you want to eat the whole of this room, I don't have a problem because it's in one go. And the picture you see is an arrested decay. So this person is to eat a lot of sweets and then stopped eating and the tooth repaired itself. That is why it looks black. So if you see someone with black teeth, there is a reason. It could be staining, it could be arrested decay. In this webinar, this is what we'll be covering. I would like people to use the chat to write down questions, to take part in the interaction. And then I'll cover about me. And I'll also cover what I have done in the past. And I'll be sharing dental prevention and tips. Finally, we will cover questions and answer session. So this is what we'll be covering in this webinar. About me, I am an innovative dental surgeon with over 25 years experience. I am a mentor. I am a poet. I am a teacher. I am an author of 3 books. I am a content creator. I have also done the Bell program. The Bell program was championed by Sir Nigel Craves to assist Black people to go into leadership positions in the NHS. It's called the Black Ethnic Leadership Program, and I've done that. I became a content creator as a result of the YouTube Accelerator program. If you go to YouTube, now people call it a university, you learn a lot. When you go to YouTube, there are a lot of people out there giving advice. And YouTube noticed that most of these people are not medically qualified. So what did they do? So YouTube decided to get healthcare professionals and clinicians together and train them to produce videos as part of health promotion program. So as a result, I got a certificate in that, and I've got my own channel where I create videos to educate others as a result of this YouTube Accelerator program, and I'm very grateful to YouTube for that. So guess what I've done? The first book I wrote was Positive Work-Life Balance, How to Transform from Tired Individual to a Happy, Empowered, Fulfilled Individual, using 7 tips or toolkits. What I've noticed about our people, I'm talking about the health service here. You go to work, you see our people working so hard, and then you ask them, how are you? And they say, I'm fine. But you know that they are not fine. They are not happy. Most of them are overqualified. Most of them have achieved a lot of things, but they are being kept in lower grades. They give it their all and all. They work with their passion. They fall in love with their job. And all they want, excuse me, is to be valued. All they want is to be valued, to be promoted, to be celebrated. And what do? They don't get that. They're treated anyway. Those who have experienced it will know what I'm talking about. So it's good to have a positive work-life balance. It is having that balance, a fine balance between work and home. If you do not have a positive work-life balance, it leads to a negative work-life balance called burnout. Now, remember, you only have one life. Live it. If you're off sick, your job will be advertised. But when you're sick, you can never recover 100%. But when you're off sick, your job is quickly advertised and someone takes that job. So you ask yourself, why am I working so hard? Some people, you hear stories. People work so hard, they never take holidays. And then one day, you hear they've passed away. They've come back from work and they've collapsed. So please, try and have a positive work-life balance. Do you know the difference? Put in the chat. Do you know the difference between a positive work-life balance and a negative work-life balance?
About today or chief dental.
We'll get there. So the second book I wrote was Mommy, What is Tooth Decay? And the next one I wrote was Poetry, Book of Poetry, Why I Create.
I think I should change the sheet.
I love voluntary work. King's College is my alma mater. So I went to King's College to plant some vegetables and fruits on King's Clover Day of Service. I love voluntary work. I did volunteer for TEDx London, and I also volunteered for TEDx NHS, and I was part of the organizing team. The staff are the heartbeat of any organization. Do you agree? And this is what I've also done. During the lockdown, I took part in artificial intelligence versus Corona hackathon with data scientists, and our team won the first prize. So that's what you can see. I've also done clinician burnout, a topic on that. And then after that, I also collaborated with a big organization and did clinician burnout conference. So now we are going to talk about teeth. Yes, I was getting there, but I was giving a background to what I've done and where I am, because I'm an innovative dental surgeon. So today, the focus is on teeth. Do you know we only have 2 sets of teeth in our lifetime? And according to research, losing your teeth is like bereavement. So it's very good to take care of your teeth. As humans, we have only 2 sets, the baby teeth or the primary dentition, and then the adult teeth, which is the secondary dentition. The picture that I'm showing tells you when you have your teeth erupting into the mouth. So if you want to count your teeth, so we use a certain system of counting our teeth, starting from the midline. So if you draw a line from the tip of your nose to the chin, that is the midline. Anything to the right is the mirror image of the other. So the first tooth for children's teeth, it is called A, B, C, D, E. For adults, it's 1, 2, 3, 4, 5, 6, 7, 8. So if you start from the midline, the central teeth you see is your central incisor. The next tooth to the side is the lateral incisor. The canine at times is called the eye tooth because it is in the line of where your eye is. If you draw a line from your inner canthus of your eye all the way down to your lip near the teeth, that is where your canine is. The teeth after the canine is the first premolar. And then after that, we have the second premolar. After the second premolar, we have the 3 big teeth. That is very important for chewing. The first one is the molar. The second one is called the second molar. And the third one is the third molar or wisdom teeth. In some people, they never have their third molars, which is the wisdom teeth. So, and there are times some people start having problems later on in life with their wisdom teeth. Now, if you have your pain with your wisdom teeth, you may go to your dentist and they may prescribe you antibiotics. According to the NICE guidelines, in the past, when people have wisdom teeth pain, we tell them take it out, but it's quite a major operation. So now, according to the National Institute Center of Excellence, you need 3 bouts of infection before you have your wisdom teeth out. So if, for example, you have a wisdom teeth pain and infection and you get antibiotics, that's the first one. And then you go again and said, oh, I've got infection with my wisdom tooth is hurting. That's the second one. And then the third one, if it happens again, then you can now decide if you want to have it removed. Now, if you've got a tooth coming through, which is your wisdom tooth, at times the gum covers it. If you keep it clean, that will be fine. If you don't keep it clean and food goes underneath the flap, it leads to inflammation, and then it leads to all sorts of problems. And wisdom teeth pain is not a joke. Pain is subjective. So what will make somebody painful, others will not have it as pain. So pain is how you feel. So yeah. So the picture I'm showing is eruption date. Now for children, I'm happy to see babies as young as 6 months old because we believe around 6 months is when the first set of teeth come true. And I'm pleased to say that I've seen children from baby to adults with not even a single tooth decay because of them taking the advice that I've told them about. That's why it's very important to practice dental prevention. It's better than kill. So if a child's teeth does not come up at 6 months, do not panic because we are all different. Some are late and some are early. This is just a guide. Now, the next thing is nursing caries. One may ask, what is nursing caries? So I don't know if you've come across some children or babies and you've seen all their front teeth is rotten away. So nursing caries is when, for example, mothers breastfeed baby. Now, when you breastfeed the baby, as soon as the child falls asleep, please take your breast out of the milk. Sorry. So as soon as you breastfeed the child and the child falls asleep, please take your breast out of the baby's mouth. If you leave your breast in the mouth, it will lead to nursing caries. Yes, it will lead to nursing caries. So the advice is feed the baby, but as soon as they fall asleep, take the breast out. And if you can register your baby with an NHS dentist, the earlier, the better. Do not leave it till they are 3, 4, 5. As soon as the teeth comes into the mouth, register the child. It gives the child confidence going to the dentist regularly, just having their teeth checked up. And normally when the child comes for a checkup, we normally apply fluoride. I remember I did a research with health visitors as part of my master's degree. I had to interview health visitors to find out what information to give to parents. Because when a mom has a baby, the first person they come into contact with after the child goes home is a health visitor. And I noticed they've been given different information. And thus I had to do an evaluation with, after that I had to make a recommendation. So how did I do it? It was part of my research for my master's degree. I had to do it in the sure start area. Now we don't have sure start area. So I did it in 2 parts. I did a quantitative research and a qualitative research. Quantitative research meant I sent questionnaires to the parents, and then I did qualitative. I had to interview the health visitors to find out what information are they giving to the parents. And it is sad when you look at the red book that they give to the mothers, there's not much information on dentistry. There was a time I was passionate about getting information about dentistry into those red books so that we start educating the parents and even pregnant women before even the child is born. So when I did a little bit of a focus group with the parents and the health visitors to find out what they know about when to register the child. And most of them were shocked when I told them you can register the child as young as 6 months old because the earlier the better. So that's very important. And then one of my recommendations, because it was sure start area, they ran out of money. By then they were giving a feeder cap, toothpaste, and some leaflets to parents. And one of my recommendations was that should still continue. But unfortunately, everything is to do with money. And one of the recommendations is to give a tube of toothpaste with fluoride, 1,450 for the whole family. So they don't have to worry, oh, what is the youngest child going to use? So it's one toothpaste for the whole family. And everybody will benefit from that. So now, gum disease, gingivitis, periodontitis. Now, do you know that I always tell people that the gums are like the foundation of a building. That's just an analogy. If you've got expensive work done in your mouth and the gums are not very good, it means you've wasted all your money. All the fillings is going to fall out, and then you cannot blame anybody because you have to take gum very, very important. Gum disease. If you brush your teeth and your gums are bleeding, that's the first sign of gum disease. A healthy mouth should not bleed. What is gingivitis? Gingivitis is inflammation of the gum. And what is periodontitis? Periodontitis is inflammation of the gum, but with bone loss. So if you when you have periodontitis, your teeth start moving in your mouth. You feel a little bit of movement. That is why it is important to visit the dentist or the hygienist. But there's been some changes. In the past, you will have to go to the dentist and the dentist will have to refer you to the hygienist. But things have changed. Hygienists can now have their own practices. So you can go straight to a hygienist. You don't have to go to the dentist. So you can go to the hygienist maybe every 3 months, every 6 months, depending on how bad your gums are. So you go to them for cleaning, professional cleaning. Yes, I know you do clean your teeth, but it's good at least once or twice in a year to have a professional clean. And the hygienists, that's what they are trained for, but they do other things as well. Some train as dental therapists. They can do fillings, they can do extraction on children's teeth. They do other things. They can apply fluoride. They do a lot of things. So yeah, so you can go to a hygienist straight or a dentist. But the best person to go for professional cleaning is the hygienist. So there are some risk factors. So there are some risk factors that makes people have poor oral hygiene. And some of the risk factors are smokers. So when people smoke, their gums bleed more. The reason is because it's like the vessels, the blood vessels feel strangulated in a way. So it affects the gums. Their gums bleed more. And then if you're pregnant, your gums may bleed more. It affects the gums. So there's something called oral manifestations of systemic disease. So there are times certain things will reflect in your mouth before you see it in your whole body. So if, for example, you've got an ulcer that is not clearing up, it's not clearing up for more than 2 weeks, and you've got risk factors of a smoker and drinking. If you smoke and you drink, your oral cancer risk is high. Or you have bleeding in the mouth that is not going away. Or you feel run down, you may end up with trash in your mouth. Or you've got some ulcer that is not clearing up. There are times people are run down and it reflects in their mouth. Or at times you may have sores around your lips. It could be you are immunocompressed. You may have oral trash. Things like that, we don't need to ignore it. There are times you may need to go to, your body is trying to tell you something. You may need to go to the GP for a simple blood test, and they may be able to pick up things that you never even know is happening in your body. So yes, it's not only about the teeth, but the mouth is like a window to the whole body. So whenever we see patients, we always ask about medical history. Medical history is very important in dentistry. So because we are not just treating the mouth, we are treating the whole body. So if, for example, you are allergic to penicillin, you need to let the dentist know you're allergic to penicillin so that he or she never gives you a prescription on that. If you've got underlying health problems, you need to let them know because it has got impact. So for example, diabetes. Diabetes have poor wound healing and it affects the gum in a very serious way. If you ignore it, you will just lose your teeth so rapidly. I remember seeing a patient and I kept on telling him about oral hygiene and he took it seriously. So he was able to hold on to his teeth. On the other hand, another one ignored it. And the next time I realized he's lost all his teeth, he became edentulous. When you lose your teeth, your gums shrink, your bone shrink, and your face falls in. So having teeth is very important for your facial features. Now we're coming to NHS versus private. If you are a private dentist, you can charge what you want if you've got a private dental practice. But the NHS has made things simple for patients to be able to understand. So I'm going to keep it simple here. The NHS simplified everything and created 4 tiers. So band 1 is an examination or a checkup. Band 2 is a filling, for example, a silver filling or amalgam filling. Band 3 is anything that involves a lab work. So for example, a denture or a crown. Band 4 is for emergency. These are the current price list for this year. Every year after the 1st of April, the prices go up. So the prices you see here today will go up next year after 1st of April. Now, one may ask, who are those who are entitled to free NHS care, free dental care on the NHS? Those who are entitled to free dental care are those on universal credit, those who have tax credit exemption, those who have 82 or 83 certificates. One of them is partial. You have to pay something towards it. Those who are under 18, those who are pregnant, those who are on income support, those who are on income-related employment support allowance, those who are on income-based job seekers allowance, and those who are on pension credits. The pension credits, you have to find out, because if you don't find out, some people are on pension, but because they have a lot of money, you still have to pay. So you need to know which one you are on, because if you claim for something, they are very strict. They will charge you. So there are times people go to the dentist and they ask them what benefits are they on, and they don't tell you the right thing. And then later on, the NHS writes to them and charges them maybe 100 and something pounds, and then they blame the clinic. So please always check that you're on the right benefits. So I'm burnt out. So you can put in the chat. Burnout, as I've said earlier, on is negative work-life balance. Now, one may ask, how is it related to the teeth? Because burnout is a form of chronic stress. Some people, when they are stressed, they don't talk about their problems, they internalize it, and it affects their teeth. Yes, it affects their teeth. And I'm sure you're going to ask me how. When you grind your teeth at night, it's called bruxism, or clench your teeth at night, and you wake up with an achy jaw. All those things are all related. And then some people also suffer from a form of neuralgia, trigeminal neuralgia. Is quite painful. And it's normally treated by giving medication by the doctor. So it's a pain that you cannot tell. And some people suffer from referred pain, so sinusitis. So if you have sinus problems, it can affect your teeth. So burnout, as I said, you can put in the chat. I don't know which one you are. This is an analogy. Are you at the beginning of your burnout, or have you worked yourself to ashes? So you are the only one who can tell me which one you are. But yes, it's related to the teeth. So if someone is grinding their teeth at night, that is bruxism. That is all signs of stress. And there are gentle jaw exercises you can do, such as curling your tongue to the roof of your mouth and closing gently. Or when you are yawning, you support your lower jaw. Or you can take some anti-inflammatories like ibuprofen or whatever, but you've got to be very careful. You can speak to your GP or speak to the pharmacist, because some people are allergic to aspirin or anti-inflammatory, so you can ask for alternatives. So this is the fact. It says in 2019-20, stress, depression, or anxiety was related to work-related. So some people suffer in silence. They don't talk about it, but their bodies suffer. So as dentists, how do we treat it? So if someone comes to me and is stressed out, or they have lower immunity, or they're burnt out, or they are bruxism. Bruxism is the term we use for those who grind their teeth. We provide them with a soft bite guard, as you can see, which you wear at night to break the habit. At times, some people come back and said, well, I've done the soft bite guard and I ground through the rubber. Then we may provide them with a hard one to see whether it will help. So it's very important that, yes, when you are stressed out, it affects your teeth. You end up clenching, you end up grinding, and you feel tense, your muscles go into spasm. So you need to relax or come to the dentist for them to give you a soft bite guard. This is another important one. Tooth erosion, acid reflux, bulimia, all this leads to sensitivity. So how do you know if someone takes a lot of acidic pills? You will notice their teeth got this glassy appearance, it looks thinned out. So tooth erosion may be due to acidic drinks. One may ask, when is the best time to brush? Some people brush first thing in the morning and last thing at night. But some people brush immediately after breakfast. So if you've had orange juice, lemon juice, or something acidic and you brush immediately, what you're doing is trying to get rid of the enamel, and your teeth become sensitive. Sensitive teeth is very difficult to treat. You can use Sensodyne toothpaste, you can rub it on it, or you can get sodium fluoride mouthwash or Fluorogard. It's by Colgate. You can buy that over the counter. So tooth erosion is due to acid. So if you go to a party and they give you drinks, one of those drinks, fizzy drinks, use a straw, because when you use a straw, you avoid your teeth touching the acid. So that's the tip. So if you go to a party and you are going to be having any acidic drinks, please use a straw. Some people suffer from acid reflux. The acid from their mouth comes into their mouth. and that can affect the back of the anterior teeth, leading to sensitivity, acid. And then some people also suffer from bulimia nervosa, where they make themselves sick. And it's a psychological, so you need the team, the doctor, the team, and everybody on board. So because there's constant throwing up, it affects their teeth become very sensitive. And then there are some of us who use very hard toothbrush to brush, and we brush horizontally, and that is a no-no. When you brush horizontally, what happens is you cut through the teeth. I've seen it. And you see people with abrasion cavities, and it's very sensitive. And then the gums recede. When the gums recede, they never grow back. So the technique we use is the roll technique. Now, the next thing is halitosis. Halitosis is another word for bad breath. So one may ask, what causes bad breath? Now, if you eat in a hurry, that can lead to bad breath. Yes, that's it. Eating in a hurry. Some people do not take their time to eat. They're always eating in a rush. When you eat in a rush, the food does not digest properly. So when you belch, you come out with undigested food and it's got a bad smell. And some people, their diets. So in the mouth, we all have different types of bacteria. I may eat garlic and I may not have a bad breath. John or someone else may eat the same garlic and it gives them a bad breath, or another food, and it gives them bad breath because of the bacteria in their mouth. So you need to know what food that when you eat, it gives you bad breath, and try and avoid it. And also brush your tongue. Some people do not brush their tongue. So if you have poor oral hygiene, it can also lead to bad breath. Like, so if you don't brush your tongue, you don't clean in between with floss, you don't brush properly, you're always rushing, it can lead to bad breath. Dry mouth can lead to bad breath because there's not a lot of saliva to wash away the bacteria or whatever. And certain medications, most medications have got side effects, can give you dry mouth, and that can give you bad breath. And also plaque buildup and smokers. So poor dental oral hygiene, dry mouth, mouth infections. So if you've got infection in your mouth and you're not even aware of it, it can lead to bad breath. And also, I've noticed when people are sick and they're in hospital, they forget about their mouth. So what we advise is, if the person is not able to brush, you can buy Cosodol. Cosodol can be bought over the counter. You can get it from any chemist shop. And what you can do, if the person can't brush and the person is poorly, you can dip a gauze into the Cosodol, especially those in hospital, or you can buy a foam that you can dip into the Cosodol and use it to freshen their breath. Now, orthodontics, diastema. So if you've got a gap between your two front teeth, it's called a diastema. Now, some people like it, some people don't like it. In some parts of the world, it's beauty. Madonna has got it. It means, yeah. So it's up to you if you want to close it or if you want to leave it. If you want to close it, then you need to see an orthodontist for that. Or if you've got teeth crowding or you're not happy with your smile. I started this with confidence smile because some people want perfect teeth, but in life, you should remember there's nothing that is perfect. So if you've got something that makes you happy, to me, that is a confident smile. It doesn't have to be perfect or straight. So that's all I can say. It's a personal choice. Now, I'm going to be focusing on dental prevention. Why am I passionate about prevention? Because if you are passionate about prevention, then it's going to lead to a confident smile. So flossing, a lot of people do not floss. Ideally, it should be daily. So there are floss sticks, water flosses, because when you clean your teeth, you are not able to clean in between your teeth. That's why you use floss. If you've got gaps between your teeth, then you got to use TP brushes. You can get it from £1 shops. Now, how to brush? One may ask, do I use the manual or electric? Personally, this is a personal choice. I prefer manual. But the only time I recommend electric is to those who have got special needs or heavy-handed with their brushing. Some people are very heavy-handed. So when they are brushing, it's best to use electric because it's got a flashy light to warn you if you are being heavy-handed. Now, manual toothbrush, it's best to use the manual toothbrush with fluoride toothpaste. That's preferably because the fluoride repairs the tooth and makes the teeth strong. That's why I'll mention fluoride. But their tooth goes for salt. Some people believe they don't want to use it, they want to use something else. There's been instances where fluoride was not in the water and it affected, it rot their teeth away. So that's why it's important to have fluoride. So yeah, so to brush your teeth with a manual toothbrush, it should be medium bristle. And there's a technique to brushing. Yes, there's a technique to how you brush your teeth. And I'm going to share that today. If you want to brush your teeth with a manual toothbrush, you hold the bristles between the gum and the tooth at an angle of 45 degrees. Yes, at an angle of 45 degrees. And then you do the roll technique and then move the gum onto the tooth. Please do not go horizontal. You do the roll technique throughout, brush the surfaces, the inside floors. Because if you do the horizontal, it leads to gum recession. Now, this is the dental tips and importance of prevention. So these are the tips I'm going to leave you with, and I hope it will help you. And also, I hope you change one of a behavior or habit as a result of the information I'm going to share with you today. So the number one is brush your teeth twice a day, preferably with a fluoride toothpaste. It could be any toothpaste as long as it's got fluoride in it, any toothpaste of your choice. And spit after brushing, if you can. Spitting after brushing means that the fluoride is still working on your teeth instead of rinsing it away with water. Yes, you can have sweets, but the sweet should be limited to meal times. Because if I tell you do not eat, you go and eat it anyway. So I'll tell you to have it, but please have it after food. After food, you can have your sweeties. And also, if you've got your phone with you now, your mobile phone, I want you to do something. Those who are interacting with me, I want you to do something. If you've got an iPhone, go to App Store. If you've got an Android, go to Play Store. You will come across a yellow scanner. It's called NHS Food Scanner app. It's an app. So if you download that app, NHS Food Scanner app, your phone becomes a barcode reader. So when you go shopping, you scan the barcode. And when you scan the barcode, it will tell you how many cubes of sugar is in the food you are buying. And also tells you, it's got a traffic light system. It will tell you how many salt, fats, and salt, fat in the food. Salt, fat in the food. And also what you should remember is during the Second World War, there was sugar rationing. And as a result of sugar rationing, and in those days, our grandmothers and forefathers were cooking from scratch. So those days, the dental decay was very low. But as soon as people started eating a lot of sweets and things like that, and not cooking, going to just getting fast drink or getting things like that, the decay started increasing. Yet you can have it by limited to meal times. So it is advisable to cook from scratch. That is why I started the 10-pound challenges.com. 10-pound challenge is to challenge you to use 10 pounds to cook something healthy for the whole family. And when you cook, because you are cooking, you know how much sugar you put in the food. So yeah, so download the NHS Food Scanner app. You can download it now. Yeah, it's very helpful. And cooking from scratch if you can, because when you cook from scratch, you can see what you're putting in the food. And then nursing mothers, please, whenever you, after breastfeeding the child and the child falls asleep, please take your breast out of the baby's mouth, or it will lead to nursing caries. So in conclusion, it's very important to visit the hygienist and dentist regularly. Register your babies as soon as the first tooth comes through. And remember, a confident smile starts with good oral hygiene. Now it's going to be questions and answers. Thank you for listening. Thank you for taking time off your busy schedules to be with me. And thank you. Thank you for having me. Thank you.
Wonderful, wonderful. Thank you so much. Thank you so much, Dr. Glavee. That was a tour de force. That was very, very, very extensive. And you know, I've made some of my own notes, so I'm looking forward to getting into the questions and answers. So again, I really appreciate it. And if we can see that there's evidence of your hard work and experience, we really, really are interested. Okay, so I'm sure you can all appreciate that it was a very Very insightful, very enlightening. And we're going to go straight to the question. So question number one. I think it's in reference to when you were talking about private care. So it says, is that free on NHS, as most charge a lot? And people don't have money for cleans or can't afford to go to the dentist, which is why a lot of people have bad dental hygiene. I just wonder how NHS can address this, as it's health inequality, sorry, even for those who are working. What do you say to that, Dr. Glavee?
That's very interesting. I think if only I'll have the opportunity to talk to the policymakers, that will make a huge, huge difference, because you cannot bring about change if you are not in the rooms where policies are being made. So in answer to your question, here we have the government spending 40.7 million pounds a year just to have put children to sleep under general anesthesia, which is a big thing, to have their teeth removed. Don't you think it would be nice if they listen to me and say, well, can we use that money to involve in oral health promotion or to do things like that? So yes, I empathize with what you've said, but I'm not a decision maker. So if we can come together as a two-day force to bring about a change, maybe do our own research and say, this is it, and this is what we want to do, and we need the funds to do it. Yes, we can make it happen.
And one of the things that we've said a lot on the Khan Health Hour is that we want to encourage our people to take responsibility, you know, and you know, I was thinking about this the other day for another setting. Often when there's a big issue like this, we are complaining to the decision makers, but we're not necessarily taking responsibility for our own actions. So the person who asked this question, I would challenge you. Do you have Netflix? Do you have Disney Plus? Do you eat out? Because a lot of us are spending money on things that don't benefit us from a health point of view. And the real issue is that we need to make some hard choices about putting our money in a place that's more likely to help. I don't think it's either or with regards to policymakers. I think it's both and. Just like Dr. Glavee said, there are places and rooms that I don't have influence in, but I definitely have influence about my own choices and my own spending. So thank you for that answer, Dr. Glavee. Next question. Can bad breath be a sign of something else going on in the body, like kidneys? I've heard that before.
It could be. I cannot say because I don't have the evidence, but what I do know is that the mouth is like the mirror of the body. And I do know, well, I'm really passionate about oral manifestation of systemic diseases. So it'd be nice to work with doctors to maybe educate, because there are times that people go to the doctors with a problem, and the doctor will say, oh, that is a dental problem. It'd be nice if we could if they could have a syllabus for medics to sort of like let them know that there are certain things that you can look out for in the mouth, which can be a reflection of the mouth without you knowing. This I know, and I'm going to share this. For example, diabetes. There's something called, if the diabetes is poorly treated, and then it may lead to ketones and things like that. That's going to details. But as a doctor, you know what I'm talking about.
Yes.
And then this person may come and talk to you, and the person may have a ketone breath, or a breath like, and you say, oh, you are drunk. The person is not drunk. The person is having a diabetic crisis. So that is just an example of how the body can be reflected in the mouth. The mouth is the mirror to the body, and it gives a lot away. You can be sick and poorly. If you have sore mouth, it's a sign that the hepatic virus has just become inflamed. You can look for a lot of signs. Your gums are bleeding and you don't know why it's bleeding. They can carry out at times I tell the patients, have you been to your GP for a blood test? And they look at me, they give me this sort of look. Yes, from the blood test, the GP can pick up on a lot of things. Your blood is a mirror of your body. I remember when we did the artificial intelligence versus corona hackathon with doctors and data scientists, And what we came up with was that if you've got increased monocytes is a form of white blood cells. It means you are prone to COVID. So these are some things that we can share. The saliva is similar to the blood. So you can do a lot of things from even your saliva. These are things that people do not know. Frothing in the mouth, dry mouth, you can pick up a lot of things. This person is anemic. Even looking at somebody's lips and eyes and things, ulcers that is not healing, that could be a cancer, carcinoma that you don't even know about. And if you're a smoker and you drink, it means your oral cancer risk is high. I didn't remember having someone coming to interview me and I said, oh, I can't say the C word. He said, no, you got to say it. So now I say it. If you're a smoker and you're a drinker, your oral cancer risk is high.
Right.
Thank you.
You so much, Dr. Glavee. And I think you're exactly right. I picked up on some of the things that you said. So I'm a big believer in me as a person being body, soul, and spirit, and that the body is interconnected. So just like you said, there are so many things. My personal belief is that God put these things as windows to make it easier for me to have optimal health. But specifically, like he talked about the difference in the knowledge base between dentists and doctors. As a medical consultant, I won't even lie to you. It's amazing the things I don't know about nutrition or dentistry. And like I said, this session today has been really, really helpful for me. And you know, maybe if you have some time off air, we could have a conversation about how we could work together, because I think you're exactly right. Doctors it would be really useful for us to say, okay, as a specialist in other parts of the body, how can one part of the body help me figure out what's going on? And Dr. Glavee is exactly right. There are lots of systemic issues, diabetes, liver issues, infections that can give you issues in terms of your mouth and breath. So that's answers that question. So question number 3, I like this question. What about using a chewing stick?
So it's culture. I remember having a patient coming from Pakistan and bringing the shwa. They call it shwa. The shwa stick. Name is it shawarma or something like that? They call it shwa stick. And then you push it down and use it to clean. As long as you clean your teeth, if it works for you, that is fine. We all come from different parts of the world. I mean, if your chewing stick works for you, as long as your mouth is clean, that is fine. I do not have an issue with that at all. Okay.
Can I add a B question to that? So I know some people who culturally use coconut oil to clean their teeth rather than toothpaste. So what's your opinion on that?
Well, to me, I think it's a fad. I don't know, but I've read about it. Call it coconut oil pooling. You know, at times in life, someone comes with some fancy thing and people do it. My philosophy is, I always say it, if it works for you, fine. I don't have anything against it.
Fantastic. Okay, so I think you addressed this, but maybe the person wasn't there. So next question is, should you rinse your mouth and be after sorry, I'll read it properly. Should you not rinse your mouth after brushing?
Ideally.
Sorry, it's best to rinse before instead, so not to remove the fluoride.
That's been answered, because as part of and this is evidence-based, Department of Health, evidence-based, that we're supposed to tell people to spit after brushing, because when you spit, and kids are very good at that. Kids don't like rinsing. That's why when you are using the toothpaste, you just give them a tiny. You don't like rinsing at all. And when the fluoride stays in their mouth, it's a sort of prevent decay.
Don't mind them. So just to point out, the question about chewing stick was from our YouTube audience. So thank you for joining us. So I have another question. So are our teeth supposed to be white?
That's a very good question. Well, so what people do not know, as I said earlier on, there are 2 sets of teeth. And the different parts of a teeth is made up of the enamel, which is one of the hardest substances in the body. People don't know how teeth is so important. So for example, if someone passes away and they cannot identify the person, they can identify the person just by their teeth. because everybody's teeth DNA is different. So the three parts of a teeth are enamel. I try to keep it simple. Enamel, the dentine, and then the pulp, the nerve. Now in kids' teeth, the dentine is very little. So that is why kids' teeth are very white. But when you come to adult teeth are a little bit yellow. And it's because of the layer of dentine after the enamel in adult teeth. So at times you get people saying, oh, my teeth were white, why are they now yellow? The reason is because in children's teeth, the dentine is less. So that is why it's rapidly. That's why when they have decay, it spreads quickly to the nerve. And then they end up with a lot of rotten teeth and they have to be put to sleep to have their teeth removed. But with adults, they have the dentine as a layer. So that is why if you want your teeth to be white, then you have to go cosmetic. And it's only reserved for adults. And the best person to do it for you is the dentist. And you can do the home one or the in-surgery one. I prefer the home one because you buy the chemicals, the dentist will take an impression and give you the chemicals and show you how to do it. And because it can be sensitive when you are doing the teeth whitening because you are taking away part of the tooth enamel to make your teeth white. So what happens is you tell the person you can whiten it today, and then tomorrow you use Sensodyne. You don't whiten it. You use Sensodyne toothpaste or fluoride mouthwash to repair the tooth back to prevent the sensitivity. Because one of the side effects of teeth whitening is sensitivity. So you've got to inform the patient. And the home kit one, the beauty is when you reach a certain stage of whiteness and it's acceptable to you, you stop the teeth whitening. You don't have to continue. So teeth whitening, to make your teeth white is a cosmetic thing. But you're not going to get that on the NHS. The NHS won't pay for teeth whitening. That's strictly private.
I mean, I have a solution for it. So obviously, first thing is stand in the sun as well, because when you do, it reflects with your teeth, and also when you do, your skin is darker, so the contrast.
Oh, and there's another tip for the ladies. If you want your teeth to look white, wear red lipstick.
Red lipstick, fantastic, fantastic. So one other question. Some of the materials used by dentists to treat dental decay also destroys teeth. How do we get around that?
Which one is that?
That's the question from one of our listeners. So you don't agree with that?
This is a very interesting one. Well, some people are allergy to some of the things. So if it happens, then you need allergy testing. So maybe the acrylic that they use for the denture, if you're allergic to it, then fine. Then you let the dentist know. There was a time that some people are even allergic to rubber or latex. So we use neutral gloves. So the only thing I can think about, if there's a chemical that you're allergic to and you do allergy testing, when you come in, you have to let us know so we don't use that on you. So that's why we use neutral gloves, because some people are allergic to rubber. I remember there was a scenario, the patient is so allergic to the extent that you have to be careful which injection you use because the injection cartridge has got a rubber band. So such cases, you refer them to hospital. So I cannot pinpoint a particular material with allergy, but if you are one of those sensitive ones, you need allergy testing. Yeah. And one of the filling I love that I use a lot is glassanoma because it repairs the tooth. It's a reparative filling, and I love using it because it repairs the tooth. So yeah.
Fantastic. I mean, I just want to go through some of the notes that I had because again I thought it was very, very informative. So the things that I thought were really helpful is prevention is better than cure. I think it's really important for us. Again, it's an encouragement from those of us at Khan and Dr. Glavee that we need to take responsibility for our health, our teeth, especially as an adult, because you only have one set. Prevention is better than cure. And I really like the point you made about the relevance of self-esteem, because our ability to show up in the world and be our best self is related to our self-esteem and what we believe about ourselves. And although, there's a balance between, looking ridiculous because you've done significant cosmetic surgery, but also enhancing your God-given gifts and using that because, like I said, I believe we are body, soul, and spirit. And I want to make sure that I show up in the world as a best representation of myself as possible. So I really love that. So Dr. Glavee, I want to give you the opportunity to say a last word before we finish. Anything, what's the last thing that you want to leave us with?
Someone says sodium chloride. It's not sodium chloride, it's sodium fluoride. Sodium fluoride. That is very helpful for sensitive teeth. And throughout my research, I came across the CAP model. So if I'm leaving this today, I want us all to focus on the CAP model. I love mnemonics. So what is the CAP model? The CAP model is K stands for knowledge, A stands for attitude, and B stands for behavior. Knowledge is powerful. If you have a lot of knowledge, it helps you with your attitude and your behavior. If there's anything I'm leaving you with today, whatever you've listened to today, I want you to change a habit or change a behavior. Thank you.
Thank you. So again, fantastic, fantastic. It's been very, very helpful for me personally, Dr. Glavee. I really appreciate it, and I know that everybody listening has also had the benefit of your experience. So thank you to everybody who listened today. These Khan talks would not be here. Would not be possible or successful without your attendance. So we're very, very grateful for those who attended on Zoom and those who are listening live on YouTube and who will listen to this later. Thank you very much. This has been your host, Dr. Ayo, and I'm going to hand over to Daniel to close the session. Thank you so much.
All right, thanks, Dr. Ayo. A massive thanks to Dr. Glavee for such an informative session. Doctor, we really appreciate you for the wealth of knowledge that you shared with us. Thank you so much. And a massive thanks to our chair, Dr. Ayo. As usual, you never disappoint. Thanks for brilliant hosting. Again, massive thanks to all our attendees on Facebook, YouTube, and on Zoom as well. Okay, so we've got some exciting announcement for you. Just a second, just bear with me. Let's share my slide. Right, so we're back again. We're back again in next Saturday for our health hour, same time, same link. Please invite a friend, family, let them join. This is really informative and they will definitely benefit from this. And then healthy hour is on Tuesday, the 23rd of April from 6:30 to 8 p.m. Please, if for further information registration, just contact email event@khan.org.uk. Khan, in collaboration with the Home Office, is also organizing a drop-in session. That's today from 1 to 3 p.m. The topic's children and immigration. For further information, please email advocacy@khan.org.uk. And then the account counseling service is also offering a bereavement peer support group session. The next session is that is going to happen every Thursday, and the next session is happening on the 25th of April. For further information, please contact Rosalind at khan.org.uk. And then Khan is also organizing a Green and Arts workshop in Stockport every Tuesday from 1 p.m. to 3 p.m. For further information and registration, please contact Green and Art Wellbeing at khan.org.uk. And then are you struggling? Do you stress out during examination preparation period? Your woes are over. Khan is organizing a young people's empowerment forum. The topic is stress management and revision techniques. Guest speakers are Sandy Kujo, Emmanuel Annan, Olushula Desulu, and the time is 6 p.m. to 7:30 p.m. And this is happening on Thursday, the 25th of April, 2024. I mean, for further information, registration, please scan the QR code. Okay. Africa Day. Africa Day is back again. This time it's happening live at the University of Bolton on the 24th of May from 10 to 3 p.m. For further registration, further information and registration, please email events@khan.org.uk. Thanks everyone for joining, and have a lovely weekend, and hope to see you next week Saturday. Okay, bye for now.
Welcome to our Caribbean and African Targeted Health Improvement Programme, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.